Welcome to Prescription for Primary Care. I'm Rebecca Ramdahal, your host for today's episode. Today, I'm very excited to be joined by Sharon Hamilton, President of the Nurse Practitioners of New Brunswick. Sharon graduated from Yale University in 2005 from the Nurse Practitioner program, specializing in oncology and palliative care. She then moved to Canada, completing her education in primary care at the University of New Brunswick. She currently works at the Fredericton Downtown Community Health Clinic as an NP, nurse practitioner, and mentors upcoming NP students. She also lectures at Dalhousie University as part of Medical Education New Brunswick in the Faculty of Medicine. Sharon, thank you so much for joining us.
I am very happy to be here. Thank you for inviting me.
Awesome. Now, first thing that jumps out at me is that you graduated from the NP program in Yale back in 2005. And from what I'm feeling, Canada is just jumping on the bandwagon now for NPs. How did you jump on this so early? in the US, they already have nurse practitioners back then?
In the US, they already had nurse practitioners for 50 years.
Oh,
when
wow.
I became a nurse practitioner. So Canada sometimes lags behind, in some regards, and this was one of them.
Yeah, no kidding. So we've been exploring how different provinces are handling the primary care challenges across Canada. So I'm taking a trip across Canada. So we did Manitoba, had a great talk with them. So I'm curious about New Brunswick's landscape. So could you start by telling us about the current state of nurse practitioner practice in New Brunswick?
Sure. I always like to begin on a positive note. So I would say that nurse practitioners in New Brunswick are generally able to work to their full scope of practice in most situations. We are very blessed in this regard because there are some provinces where this is not always the case. We have other challenges, and our challenges lie in finding suitable employment opportunities, in a lack of funding models that allow nurse practitioners to practice where and how best suits their interests, their expertise, and their needs, and in sometimes unrealistic expectations of some employers as to workload obligations, or also even sometimes a misunderstanding of the nurse practitioner role.
Mm-hmm. People get very confused about what nurse practitioners are, registered nurses, practical nurses. So yes, nurse practitioners, I mean, your scope is wide. You can do many things that doctors can do, aside from maybe brain surgery. Right.
Yes. We can't do that.
So in New Brunswick, you're also having primary care issues, just like the rest of the country?
Yes.
Okay.
I think there's challenges in every profession. And so we have our set of challenges that we're always working on and always working to find solutions.
Okay. So the recent data was showing about 180,000 residents don't have a primary care provider. So how are DNPs currently positioned to help address this crisis?
Well, did you know that nurse practitioners are the second fastest growing profession nationally? Therefore, nurse practitioners could significantly influence the healthcare landscape in a positive way. For example, we have 45 nurse practitioner students graduating in New Brunswick in 2025. Nurse practitioners commonly secure rosters of 900 to 1,000 patients within 3 years. So this graduating class alone could potentially take 45,000 patients off the wait list.
Whoa, that's amazing.
Yes.
Would you say that the programs, the NP programs in New Brunswick, they're starting to gain some steam, like some interest? Enrollments are going up? Oh, awesome. Yes. So your organization has been advocating for nurse practitioners to either start their own or join publicly funded collaborative care clinics. Could you explain why this model is particularly important for New Brunswick?
Yes, well, despite rigorous training, nurse practitioner graduates in New Brunswick often find no available job positions. So,
Mm.
this underutilizes a valuable healthcare resource. Nurse practitioners are prepared for autonomous practice and collaborate with other professionals when needed. To fully leverage their skills, nurse practitioners need a publicly funded model allowing them to establish or join clinician led clinics. This would ensure that they are compensated and improve patient access to care. Such a model also would promote fiscal responsibility, with nurse practitioners salaried at a specified rate tied to their patient roster size, ensuring predictable healthcare costs and maximizing nurse practitioner impact. So it's a win-win situation all
Mm.
the way around.
New Brunswick has some unique challenges, particularly with its rural communities and official bilingual status. Do these factors impact NP practice at all?
Well, Rebecca, you've certainly raised some important issues here. Nurse practitioners often have established families prior to becoming nurse practitioners. So the ability to move where there may be an employment opportunity is not always feasible. So we have proposed recruiting students who live in those rural areas and
Mhm.
providing scholarships or other funding modalities so that students can complete their education and then provide healthcare to the communities in which they live. As far as the bilingual aspect, we're fortunate to have both Francophone and Anglophone universities in our province. So the bilingual needs have not appeared to be an issue.
Okay. So I just want to reiterate a point. Earlier, we were talking about, nurse practitioners and the confusion, and correct me if I'm wrong. So I just want to let the audience know what exactly nurse practitioners go through to gain their education and experience. Primary care nurse practitioners have a minimum of 6 years of academic training, an undergraduate registered nurse degree, and a master's degree, plus clinical experience. They perform many of the same duties as family doctors, including assessing, diagnosing, and managing patients, ordering tests, prescribing medications, and referring patients to specialists. Would you say that's accurate?
I would say that's very accurate. And can we just stop there for a minute? Because I would like to respond to what you have just said.
Of
So
course.
I really thank you for explaining our education, Rebecca, because our profession and the physician assistant profession is often considered as equal to those who do not understand. But
Mm.
nurse practitioners have a minimum of 8 years of education, including our clinical education, whereas a physician assistant only has 4 years.
Mhm.
So they only have half of the amount of education that we have. So they
Mhm.
are not autonomous providers, but
Mhm.
under the supervision of a physician, whereas
Mhm.
nurse practitioners with a minimum of 8 years of experience and education are licensed to provide care without supervision.
Mhm. Mhm.
That's
Yeah,
an important distinction to make.
absolutely. Yes, we're friends of physician assistants as well because we think there's a role for everybody in our primary care.
Absolutely.
So absolutely, and yes, they're under the supervision of the doctors, and but yes, that distinction is important. The PAs and NPs, um, there's a tier, obviously. So thank you for that. Now, there has been a new standards of practice for NPs that came into effect in July of 2024. How do these updated standards support NPs in addressing the primary care crisis?
Yes, the standards of practice very clearly state that nurse practitioners are autonomous healthcare providers, while delineating the responsibilities that nurse practitioners carry to provide healthcare in a safe, competent, compassionate, and ethical manner. They also clearly define the nurse practitioner's responsibility to engage in professional collaboration, in leadership, and in advocacy to influence and support healthcare reform and achieve optimal outcomes for patients, for health policy, and health systems. We need to be included at the table when government, policymakers, and other healthcare stakeholders meet to discuss how to best tackle the healthcare crises that we are facing in our province. We promise we will never come to the table to only complain about the issues, but we will always come with plausible solutions for a better tomorrow.
Yes, absolutely. I agree with that. Now, New Brunswick has made several attempts at collaborative care models over the past 20 years. From your perspective, what needs to be different this time for it to succeed?
Well, let me tell you a few things. So every time a collaborative care model has been introduced in the past 20 years, nurse practitioners have been left out of the equation completely. There has never been an NP at the table when discussing potential solutions. In fact, there has rarely been collaboration with other health professionals who are in the trenches and also understand what is needed so our healthcare system can thrive. And there has never been a collaborative model that proposed nurse practitioner inclusion in that model with a related funding model to pay the nurse practitioner for their services. So when you ask me what needs it to be different for it to succeed, I think it's pretty simple. Get the people at the table who are working on the ground, who knows what needs to be done so that our healthcare system can thrive, and include funding models that provide a means for healthcare professionals to be paid for their services.
I mean, I'm just so baffled. Like, how are you not at the table? I mean, it just makes sense. I mean, healthcare. You need healthcare leaders and workers to provide the input for this. I mean, I
But
just.
it's not just us. It
Oh,
is
no, not just you.
all health professionals. It's like we
Absolutely.
need to be at the table because we are there every day, on the ground, seeing the problems and the challenges. And you do, develop some great ideas as to what could be solutions to our healthcare crises.
So we've set an ambitious goal of ensuring all New Brunswickers have access to primary care by 2026, which is great. Obviously, what you just spoke of was probably one of the more important steps for it to happen in order to get this goal to be achievable.
Yes. We have a lot of ideas. And I could probably go on for an hour talking about all the different ideas that we have as nurse practitioners of New Brunswick, but I'm only going to focus on the ones pertaining to nurse practitioners, okay? So to ensure all New Brunswickers have access to primary health care by 2026, we need to involve nurse practitioners from the start. So here are some key steps that we believe could be very helpful. One is inclusive planning. Include nurse practitioners, physicians, and other healthcare providers in discussions to set up the 30 clinics that are proposed by our new Liberal government. Mm-hmm. Number two, to develop that public funding model. So develop a publicly funded remuneration model for nurse practitioners to expand employment opportunities. Number three, we're going to need nurse practitioner contracts. So create contracts for nurse practitioners to lead or to join team-based clinics, leveraging expertise from provinces like British Columbia and Alberta, who have already done this. Mm-hmm. Another thing that we think would be very important is to establish a government nurse practitioner position. So establish a nurse practitioner focused role in government to develop recruitment and retention strategies for nurse practitioners in the private sector and virtual platforms, to collaborate with universities to track graduating nurse practitioner students and ensure immediate employment, to develop mentorship programs for new grads with the universities and the health authorities, and to work with national nurse practitioner associations to improve primary healthcare access. Find out what's working in other provinces and then see how can we model it so that it fits in New Brunswick with our population and our geographics. So
Mm-hmm.
there's a lot. And then I have a fifth one here that I think is really important, and that is emergency department triage. Revise the hospital emergency departments throughout the province to triage less critical cases, levels 3, 4, and 5, to adjacent clinics staffed by nurse practitioners, reducing the wait times and easing ER congestion. We have
Yes.
such crowded emergency rooms, and so many of the patients there don't belong in an emergency room. So if we had an adjacent clinic to the emergency room where they just were triaged and filtered, you either go right to the ER or you go left to
Mm-hmm.
the episodic care. And I think that would be
Oh,
an
that would be amazing.
solution for our overworked physician colleagues and the just incredible situations that they face every day in their emergency departments.
These are some great steps that you brought up, Sharon. So have you been meeting with like provincial party leaders about modernizing primary care? So what key message do you want them to understand about the role of NPs in transforming healthcare?
Well, like I say, we have met with Susan Holt and the Liberal Party on several occasions. We have met with David Kuhn of the Green Party. We never were able to have an audience with Premier Higgs when he was still in office. But yes, it was very wonderful to be able to speak to the Green Party and the Liberal Party, and they're very supportive of NP integration into primary health care clinics in New Brunswick. But my key message, I believe, would be that nurse practitioners are licensed, autonomous healthcare providers who safely and effectively diagnose, treat, and manage patients' illnesses. However, we need a funding model to fully deliver the care we are trained to provide. Please help us develop this model to ensure greater access to healthcare for all patients, regardless of where they live.
Mm-hmm. Well,
That would
I
be
would.
the message.
That's a great message. So to wrap up, Sharon, is there a message you would like to share with our listeners about the future of nurse practitioner practice in New Brunswick and its potential to transform delivery of primary care?
Yes. My message to our listeners would be nurse practitioners deeply care about their patients. We do care about you. Nurse practitioners want you to receive health care expediently when you need it. We will continue to reach out to the government and other stakeholders to fight for you, and we will not stop until everyone has access to health care. Your lives and our children's lives depend on it. Nurse practitioners are licensed, autonomous healthcare providers who safely and effectively diagnose, treat, and manage patient illnesses. However, we need a funding model to fully deliver the care we are trained to provide. So please help us develop this model to ensure greater access to healthcare for all patients, regardless of where they live, because together, we can create a healthcare system that works for everyone.
Mm. Thank you, Sharon. Thank you so much for being with us and sharing your insights about New Brunswick's healthcare landscape. We really appreciate your time with us today.
Thank you. Thank you very much. Thank you for having me.
Absolutely. And come again back anytime. I'm sure we have lots to talk about. To our listeners, thank you for joining us for another episode of Prescription for Primary Care. Until next time, good health and better healthcare.